In the quest to support the healthcare system of Liberia in line with its 10-year health and social welfare policy and plan, the United States Agency for International Development, USAID, through key partners, has rolled out 2 healthcare initiatives valued at $57.2 million over a 5-year period. The official launch of the USAID Collaborative Support for Health, CSH, and the introduction of its Partnership for Advancing Community-Based Services, PACS, brought together major stakeholders in the health sector, other USAID partners, and the media at the Bella Casa Hotel on 4 June 2015. The Collaborative Support for Health CSH program, implemented by Management Sciences for Health MSH and its partners Jhpiego, Result for Development, R4D, RHI, and the Development Innovations Group, while the Partnership for Advancing Community-Based Services, PACS, implemented by IRC and its partners, Global Communities, PSR Liberia, YMCA Liberia, and Planned Parenthood Association of Liberia.
Ladies and gentlemen,
Mounting the podium, the acting chief of party of the CSH program, Dr. Florid Niyuhari, detailed the scope and nature of the program, as well as its geographical coverage.
This is a project that is going to be implemented over the course of 3 years with an optional 2 years. The amount of the contract is about 32 million. The first 3 years will be about 21, and then the optional 10 million for the second year. The project is going to be focusing mainly on the central level, and we focus on 3 particular counties: Lofa, Nimba, Bong. I just wanted to bring it to the attention of the audience that these 3 counties cover almost a third of the Liberian population. And so we expect the project to have an impact. But I also wanted to mention that through our collaboration with the ministry and other partners at the central level, we expect to have like a secondary impact in other counties we may not necessarily be directly involved with. We intend to use a collaborative approach through which we will work side by side with our ministry counterparts. We will provide technical assistance, mentoring, coaching, and I also wanted to mention that this is a methodology that was inspired by the USAID Human and Institutional Capacity Development. The project was inspired by the basic package of health services, along with the essential package of health services. It is also conceived in line with the National Health and Social Welfare Plan, but also aligned with the investment plan for rebuilding a resilient health services. At the central level, we will be supporting cross-cutting themes, but we will also be supporting the Ministry of Health and the Ministry of Public Work.
She also acknowledged the gains that have been made in Liberia's health sector over the years.
And finally, all the effort we're putting in, all the tools, all the training we're providing, or the mentoring and coaching are meant to really have an impact at the facility level. I wanted to share a little bit the area of focus, where we will be focusing. But before I get into any of them, I just wanted to let you know that, yes, this is a new project. We have been on the ground for a little bit over 3 months now, but we did our due diligence to really understand what is the context we're working in. And we're coming in with the acknowledgement that so much has been accomplished by the ministry and the partners, of course, and yet so much more remain to be done. So in that regard, our approach is going to be building upon the gain from the past years. We're not going to act like we're starting from scratch, but we will be rather building on those efforts and then focus on some of the areas that I wanted to share. The first one is develop the leadership, management, governance, capacity at all levels of the ministry. What do I mean by all level? I mean the central ministry, the county, but also the professional association. And I wanted to mention that even if we're having the official launch today, we have actually started some of the implementation. We were introduced officially by the Ministry of Health in some settings, and we have started implementing. And this is one of the activities that we start actually implementing at the central level. And we did a consultation which was attended by senior ministry level. I'm looking at Sister Barbara, she was there. We have representation from the Governance Commission and the Professional Association, and we have a discussion on how we can best design a program that is going to help the ministry and the Professional Association achieve the goal they want to achieve in leadership, management, and governance. We will be going to the counties, and we will be conducting similar consultation, and we hope more and more ministry people will take advantage of this program, which is going to be that we're getting ready to start in a couple of weeks with the first cohort, and we hope more people will be joining. The second area will be the institutional quality assurance and quality improvement. Again, this is an area of extremely high importance in light of, in the wake of the epidemic situation that the country just, successfully emerged from. We're working with the partners who were involved in the border response, and we're trying to learn some of the best lessons in order to promote better quality of care and better services that are accessible to all the population.
It is in duty to invite to the podium our second presenter, Mr. Tanu Diallo of the PACS project. Mr. Diallo.
Tanu Diallo, the Chief of Party of the USAID Liberia Partnership for Advancing Community-Based Services, talked the 5-year initiative, which predominantly focuses on increasing access to quality community-based health services.
PACS is a community-based program, and it stands for Partnership for Advancing Community-Based Services. It's a cooperative agreement with USAID, and we will be covering the same counties, Bong, Lofa, and Nemba, with an office in Monrovia for supporting centrally founded activities. We'll be working with the Community Health Service Division, the Health Promotion Division, Environmental and Occupation Division, all the central divisions for helping them on the policy side and be sure that we are well aligned with the national strategies and training materials. The PACS objectives and the results are: one, to be sure that we are reinforcing the capacity of the MOH, the central level, the units that I was just saying, to make sure that we have a very comprehensive community-based program that will be able to provide community services to the population.
We would like to increase the availability and the quality of community-based and social services, improve health-seeking behaviors and practices, but also increase access to WASH services. The project started in February 2015 and is up to 2020. Budget is about 27 million, including about 2.5 million in cost share. Partners implementing the project are IRC, International Rescue Committee, as a lead partner. So IRC is responsible for the management of the program, but also for reporting and being the point contact for the MOH and USAID. We are so fortunate to have global communities, well-known organization in this country, providing WASH services, and they will be in charge of scaling up with CLTS plus activities. We also have PSI, Population Services International. They will be in charge of providing technical leadership to communication strategies and marketing WASH strategies. We are fortunate to have two local NGOs, the PPL, Planned Parenthood Association of Liberia, and YMCA. They will be in charge of rolling out the community-based services. And most importantly, please see the last line. We have about $3 million USD available for local CSOs, CBOs to work with for scaling up and making sure that community services are available to the population. And those CBOs and CSOs will be selected in coordination with not only the healthy county teams, but also the superintendents of the administration. We will be sure that the government is part of the selection process, and we will go only with the CBOs, the CSOs that the government will be approving. How do we operate? At the central level, we will be embedding staff, once again in coordination with the unit. The Community Health Service Division, the Health Promotion Division, all those divisions, we will be sure that we identify, select, and recruit well-professional technical assistants that will be based at the MOH level to provide what is called TA, but it's not the normal day-to-day implementing activities. They will be there to provide really technical assistance for two years, let's say, and we will set up a clear performance improvement program, and we will be monitoring that to be sure that those TAs are providing the required technical assistance and they can phase out as soon as the TA has been transferred to the government.
U.S. Ambassador Deborah Malak stressed the efforts made by the Liberian government and the people of Liberia to fight the Ebola outbreak.
It's nice to be here today to talk about the future, to talk about what we, the positive, because we've spent so much time over the last year talking a lot about things that are very difficult for all of us. So it really is a pleasure to be here to launch these two new flagship projects that we believe will help to improve the health of many Liberians, supported by the U.S. government through the U.S. Agency for International Development. The past several months, really the past year, have shown us that having a functional healthcare system is critical to Liberia's overall development. We have seen the struggles of healthcare workers to deliver needed health services for those affected by Ebola and those who were not affected by Ebola, who needed just basic health care and were unable in some instances to access those services, such as immunization, antenatal care, or treatment for malaria. Now, we all know the tremendous resilience that Liberia and Liberians have shown in the face of the crisis over the last year. And I have spent a lot of time in the last few months speaking publicly about the amazing work that Liberians have done to end Ebola in Liberia. We were proud as the U.S. government to be part of supporting those efforts, but at the end of the day, it was what Liberians themselves did to bring about where we are today. And so it's worthy of note, and I think it's a topic that we'll be talking about for a while. But many of the people in this room, under the leadership of the Ministry of Health, as well as the leadership of President Sirleaf, have worked tirelessly, sometimes in the face of great personal risk and sacrifice, to help your fellow Liberians respond to Ebola. And although Ebola remains a threat, because we still see cases across the border, I am extremely confident that all of us together, but most importantly Liberians themselves, are vigilant and will know what to do if we are again, if we do again encounter Ebola cases. The capacity is now at least somewhat available. We've recognized the enemy. We know what to do. I'm very proud that the U.S. government has been a partner with Liberia throughout this crisis, but even before. We've committed on the part of the U.S. government nearly $1 billion to fight Ebola in the sub-region. Now that's not just obviously in Liberia, but we've also helped to mobilize support from around the world. And we continue to be the largest single donor, the largest bilateral donor providing annual development assistance to Liberia's health sector. Through the U.S. Agency for International Development, our government provides nearly $47 million annually to support Liberia's health system as of 2015. Again, in line, as you've heard from our two projects here, in line with the National Health and Social Welfare Policy document, but we are also committed to supporting the restoration of basic health care services and strengthening of the health system in line with Liberia's investment plan for building a resilient health system. So we have continued to look and work with the Ministry of Health to ensure that our efforts line up with where the government of Liberia wants to go.
USAID played a major role in the fight against Ebola through several programs, including providing logistics to combat Ebola. They are committed to doing more in Liberia's post-Ebola recovery drive. Health Minister Designate Dr. Bernice Down lauded the U.S. government's efforts toward the Liberian health sector and recounted the copious assistance by USAID in streamlining Liberia's post-war healthcare delivery mechanism.
I will first start by saying thank you to the U.S. government for its support to our country, Liberia, and more especially support to health. I can recall in 2006 when we had to start rebuilding the health sector. USAID, through its technical support, helped us to design the first health policy and plan and the first service delivery package, the BPHS, which later on became the EPHS. And they made sure that they helped us to implement that package. They provided the support for the implementation, and they aligned other partners for the implementation to the health plan. They also work with the Ministry of Health to build the kind of capacity that is required to be able to move forward. And we started building. Today, Ministry of Health, like you heard, receives U.S. government funding directly to support service delivery. And Liberia is the first country for developing countries, and it's a test case. And we are very proud of that because it puts the Ministry of Health in the driver's seat. It allows the Ministry of Health to make the decisions that the government would like to make in terms of implementation. They've also worked with us, with other partners, for designing the resilient healthcare package. And they are demonstrating here today what they demonstrated 2006 by aligning the resources that will help to build the resilient healthcare delivery system. We have worked with the two partners to align the resources the way we want it to be. In recent times, we've been working with all partners who are interested in our community health. And we are really looking at the community health care policy and the strategy. And we have agreed as a Ministry of Health, we should remunerate community health workers. We believe it is a way to engage young people constructively and to empower them. We thank you for your community health project. because we have started discussing the alignment to it. And all the community health partners have been on the table on the discussions also. We look forward to finalizing that community health policy and strategy and launch a national community health workers program more constructively. We also want to thank you for this continuing to build the systems that it will take to have the resilient healthcare system. We thank you for helping us for bringing Ebola to zero, and we look forward to working with all the partners in this consortium and the USAID moving forward. Thank you.
These two programs harness a qualified set of international non-governmental organizations with extensive experience in access to and quality of health services, as well as WASH, W-A-S-H.